Hi, Dr. Bernardo from New Jersey Plastic Surgery. Delores, how you doing?
Hi, Doc.
Okay.
The only doctor I get excited to see.
So we have an upcoming procedure, right?
Okay, so here's why I'm here. I'm going to tell you why I'm here. Okay. My breasts were done, and they're sagging. They shouldn't be. It's only 2 years.
2 years, okay.
My stomach is flabby. There's extra skin. I've lost a lot of weight at one time.
Mm-hmm.
So that's bothering me.
Okay.
And I just feel like it's extra skin. So, as you know, if I lose, it doesn't matter if I lose weight. There's still extra skin there. Am I wrong?
Weight, you can lose weight. You can go to the gym. When you change your muscle, change your fat, it doesn't change skin. We can change skin. Gyms can't change skin.
Gyms, diet.
Can't change your
cannot
skin
change
tightness.
skin. Creams.
Well, not what we're going to do.
And, okay, so that's my thing. And then my biggest problem, the rest I can get away with, are my legs. I have loose skin on my legs.
Okay.
And I'm embarrassed of them. And I don't have a lot of faith that they can be fixed. So that's why I'm here.
All right. So we will break this into parts, but we're going to look at getting your breast lifted up. We have some new things that you don't see in a lot of places that can help. For example, if your breasts are very heavy and you just remove excess skin, the heaviness over time, a year or two, can still pull the breast down. Nothing's supporting it to work against gravity.
Well, that's what happened to me.
So we have these new sutures called refined sutures, which actually go into the breast tissue and hold it up against your chest wall. And that's like an internal support. And we've done this now for quite a while, and we have patients out a year and a half. These patients, they're older than you. They're in their 60s, and it's still up like that.
Because I have like, it's just, I can't not wear a bra with anything, and there's a lot of my wardrobe doesn't require a bra, or it doesn't fit right.
Right.
And like sometimes in my interviews, I do a lot of confessionals from the waist up. And the other day I had such a problem because there was a shirt that was approved to wear, and I couldn't wear it because I needed a bra with it because they sag, and it took hours, tape, nipple stickies, everything you could think of, and they still looked horrible in the shirt that they had to stop production, and I had to go buy another shirt.
So hopefully with what we're going to do, you won't need a bra for them to hold up.
Yeah, well, hopefully, yes. On my faith, I've heard a lot of good things about you.
And also we're going to exchange your implants.
Okay.
Right? What kind of implants do you have in now?
They're saline.
Saline. All right. We're replacing them with a type of saline, but it's called the ideal implant. It is called a structure. It's really a different category called structured implant. There are several chambers in it. It's still a saline, so you don't have to worry about that silent rupture you could have with silicone implants where the shell could be ruptured, but you don't know it. So these are very safe. They have good projection. They have very good statistics down the line. So we'll be using those for your replacement. And then
Are you giving me a lift also?
you are getting a lift also. And we're going
I've had one.
We're going to
I need
convert
another
your
one?
scars. We're going to remove them, and then afterwards we're going to do laser on the scars so they'll heal better than your body normally can. So that'll look even better too.
Okay. Now this laser, this is something new that I'm hearing about now. So after every procedure, you do laser on the scar? Is that what you do?
When we did this study on the lasers many years ago, and It's for any areas we're doing that have longer scars, like we would use it on tummy tucks, we would use it on breast lifts, and we can show you photos, but you can see the comparison to just healing on your own versus the laser can make it heal better.
I agree with that.
That's even better.
Okay.
And then what? And you have a lot of things on your list, and the last one is,
Of course I do.
of course, the loose skin on your
It's really
abdomen.
the first thing.
And loose skin on your abdomen and loose skin on your thighs.
Yeah.
And that area, there are certain areas of the body that we don't have a surgical procedure for. We can't, like if you have loose skin in certain areas, we make an incision, pull it tight. But in other areas, you can't do that, particularly
Why not?
the thighs. Well, I can't really make a big scar up the middle of your abdomen.
Well, don't they put it in your, I've heard about.
That's a medial thigh lift, but that has a limited amount of where it pulls. And when you have bigger areas, or you just have mild to moderate looseness, we have technology today that we don't need to make incisions. And that's a device called the Body Tight, and that'll go under your skin with energy and get skin tightening without the big incisions.
Now, I'm a little skeptical of that.
Well, sure.
Because I don't believe in it's a little invasive, correct? I get what you're
You
saying.
make a little poke,
It's like
that's
a
all.
liposuction type of procedure?
a little few millimeter incision, and then the energy probe works under and over your skin. It's almost like ironing.
I've heard good things. I've heard good things. And I know that you are the latest and greatest with all these lasers. And do you write the protocol or something?
We are the research center. We are the training center.
So, see, I'm a little
we know a little
privy
bit about
to
these things.
and that's why I'm choosing you for this.
So for
Because I don't like, I've given up hope on the fact that I'm going to ever have smoother legs, no matter
Mhm.
what I do. And I just came from the gym, obviously.
right,
But
gym's not going to help that.
I know this, and I'm very, very
So-
upset about it.
If this makes you feel any better, just this past weekend I was speaking at a meeting in New York called The Cutting Edge with top plastic surgeons from all over the
You
world.
should have invited me. I would have loved to come
And
say no.
Their questions are just as you had. Is there any research on this? I showed them the published papers in our plastic surgery journal. Do I have long-term result photos? I showed them 2-year, 3-year, even 10-year, and all about the safety, and I showed them all of that. So yeah, we have a long track record with these things.
Doc, if you can fix this, you're gonna be like the most famous ever. Like unbelievable.
Okay,
I'm
so
telling you. I'm
the
gonna wear
last-
shorts again. You think?
That's what we're working for.
With confidence.
That's what we're working toward.
Oh, okay.
Sometimes you can't do it all at once, but that's what we're going after. And the last thing I want to say is there's a bunch of things on your list, and that's too much to do at first.
I know.
So I think we're going to break this up into 2 parts. I think first the step is let's start getting some of the skin tightening going and do that as the first procedure. Reason is because when we do those procedures, it doesn't tighten overnight. It keeps getting better and better over months. So we'll get that going, and then we'll
Summer's coming.
That's right. So now's a good time to start on that. And then we'll come back and do the breasts, which you kind of see those results.
I can
pretty
live with
quick.
this. My stomach is not like, the skin tone on my stomach is fine. I'm not like terribly distraught over it. But from the waist down, can you do, how about this? I have an idea.
Okay.
Can we do all my legs at one time?
We're going to see in a minute. But we'll see how much we could do at once.